This impacted third molar tooth. You can see the third molar is the third molar is completely, almost completely invisible. Okay, and it is a distriangular type of tooth. So now I am placing the clavicular incision. I usually do not give anterior releasing most of the cases. So here is a clavicular incision I am giving. And now I have to palpate the coronoid. And just along the coronoid I will give the distal releasing incision. Okay, so distal releasing will be like that. Okay, so I've raised my flap. Now elevate the lingual periosteum. Okay, I'm elevating my lingual periosteum like this. And this is a broad-ended Howard's or mold elevator, and I am the suction. To hold this lingual flap retractor, we can just use this, this mouth prop chain like this, and it will retract like this. Okay, so I'm using a round bar first to uncover the bone. These two angular infections are the most difficult infected tooth to remove due to the path of removal is challenging. Okay. So you see I'm removing the peripheral bone, which is called bone guttering, and the depth and the width of the guttering is very important. I will try to elevate the tooth without decapitating it first, because the roots are conical in shape. So I will check if it comes out after my placement of the elevator. Okay, I'm just refining my guttering, the areas. Okay, section. The roots are three roots are there. Separate roots are there, and but the nature of the roots are little conical. Okay, that's why it came out easily. Otherwise, we have to do a decapitation, remove the crown first, and then remove the roots. So I am just checking it with my fingers if there is any sharp bony projections or not. So a little projections are there which I can trim it off, very little. So I am using my round burr. I prefer to use round burr instead of using bone file. Okay, so now the margins are smoother and healing will be better. And now irrigate the socket, irrigate the soft tissue flap inside of the flap, irrigate all the areas and then close the flap. Okay, so now you can see the flap is there, nice flap without any tear, without any soft tissue tear. That is very important for better healing. The more we care for the soft tissue, the better healing we get, the less edema. And this is my first bite. I am taking the distal papilla of the 7. Okay, and I will try to take my lingual bite little slightly anterior, slightly anterior, so that the flap comes and comes together and encircle the distal end of the 7, and there is less pocket formation will be there. So I am repositioning my flap like this. I am putting my finger and you can see putting my index finger right up to the knot. Okay, stitch cutting. You can keep it little in length, little bigger, the content of the sutures, so that when you remove the sutures you find the end, because when the healing starts usually the wound shrinks and the suture go inside the socket and it's difficult to find out during suture removal sometimes. My next bite will be here. Usually 3 bites I take, 3 suture by interrupted sutures. You can see 3 interrupted sutures like this. চোখ বন্ধ রাখ, ধরতে হয় এগুলো। Distal releasing incision, and I am using a long tooth forceps that I am controlling the every tissue movements is handling from outside the mouth, so I am not obstructing my working field